Many children with autism and toddlers showing signs have very little to no vocal communication. Today, we're talking about tools that can improve the vocal speech of individuals with autism and related disorders. Hi, I'm Dr. Mary Barbera, autism mom, behavior analyst, and best-selling author. Each week, I provide you with some of my ideas about turning autism or signs of autism around. So if you haven't subscribed to my YouTube channel, you can do that now. So today I'm sharing an excerpt with Riska Solomon, who is certified at level 4 certification for Talk Tools. Riska is a BCBA and takes a very behavioral approach to improving language, especially for children that have speech issues, that are not vocal or minimally vocal, can be used for articulation issues, drooling, and feeding. So where's the research?
So that is what we're working really hard on. I'm glad you asked, because we are working really hard. I mean, when I was looking at speech interventions for Dan, I was actually really quite shocked and upset to find a study back in 1968 that was done in London, here in the UK, that looked at tactile cues to prompt speech sounds and operant condition. And I just thought, wow, back in 1968, collaborations like that were happening and came out with good outcomes. And yet that research, where is that research now on using these tactile cues and things like that? So we actually were very fortunate to get a European grant. This was prior to Brexit, but it's still happening at the moment. We've still got the grant money up until October this year. So we had a 3-year fully funded PhD student. So we've actually got a PhD student in collaboration with the University of South Wales and their ABA department. Richard May is the supervisor there. And they've been brilliant, really supportive. And this research grant is called a KES2, and it's about bringing universities and businesses together to do research on something that the business chooses. So, of course, we chose Talk Tools and ABA. So we've actually collaborated with a school in London, in Ealing, Blooming Tree School. And they've actually got a behavior analyst there that has just gone through certification in Talk Tools. And she'd approached me, Alice Carricky had approached me and said, could you give me some supervision on implementing this with some of our children? And I sort of said, well, actually, we're looking for a place to do the research so as we can really control the training and making sure the fidelity of the interventions. So we are working with them to implement the Talk Tools. We have got extended baselines and randomizations and all sorts to get good experimental control. And Sophie Bradbury's our student, and she's worked so hard. She's, spent so long. During COVID was when we first got the grant. So she was having to work on it a lot in isolation at the time, and did all her sort of literature reviews and everything, and really got to grips with what Talk Tools is all about. And now we're in the intervention phase. So we're currently taking data. We're due to finish taking the data in July, and then Sophie will be writing up then hopefully for the next few months after that. So, don't know what the outcomes yet will be, but the children are starting to make some good progress, which is very exciting already. Quite a few of them have got new sounds and things. And the interesting thing is we're actually doing it with a selection of non-vocal children and verbal, highly vocal children, but that are missing some sounds. So it'll be really interesting to see what the results are with regard to, the different effects that Talk Tools might have with these different range of children.
I hope you enjoyed that small excerpt from podcast 223. If you did, I'd love thumbs up, leave a comment, share it with somebody else who might benefit. And for more information about how you might be able to join our online course and community, attend a free workshop. And I'll see you right here next time.